Okay. We have an 8-year-old who's presenting today with his mom. They are wanting evaluation for ADHD. They were here a couple of weeks ago and did their sports annual physical, and mom had some questions about ADHD at that point. She was sent home with the Vanderbilt ADHD rate scale and gave two to two different teachers, and then she completed one. 2 of the 3 have scores that suggest ADHD combined inattentive with hyperactivity. Symptoms, he's been struggling more and more in school, and now he's struggling in his church group. He is having issues at home. He loses things. He forgets things. He's impulsive. He does meet diagnostic criteria for ADHD. I would definitely like to start with just educating family and make sure that they understand that having a routine is really great for someone with ADHD, to make sure that they're not having lots of caffeine or lots of sugar or lots of screen time right before bed or in general, really. Also want to put in a referral for neuropsychology to rule out some differential diagnoses like learning disorders or anxiety and depression, autism spectrum disorder, OCD, and maybe other mood disorders. I also want to collect a little bit more data while we're in the clinic today, and I would like to have both the patient and mom complete the revised children's anxiety and depression scale, and so we can screen for a little bit of anxiety or depression, see if that is something we need to be focusing on as well as the ADHD. I also want to give them resources for therapy. I prefer cognitive behavior therapy, but I'll give them lots of referrals or resources that they can look at. Family therapy might be a good thing as well, depending on their needs. I also want to discuss goals of care with mom and with the patient. That will help us determine what our best pharmacological intervention should be if they so choose to do that. I need to know, are they wanting to take the medication if they want a medication every day? Do they want it only on school days? Do they want a long-acting, which acts longer but can interrupt sleep stuff? Or do they want a short-acting, which you might need to take multiple times during the day? If they really, really want to start a medication today, I would recommend methylphenidate extended release, starting at 10 milligrams every morning. Have them come back in about 2 weeks and we can reassess, make dosage changes or medication changes as needed. Definitely get them into neuropsych as soon as possible to rule out all of the other differential diagnoses I talked about. And just to give us a more clear diagnosis to make sure that we are doing the absolute best thing to treat and support this family as we can. Thanks.